Hello everyone, I'm Namiiro, a registered midwife working with a non-government organization called Knowledge for Change, which is in partnership with the UK and Uganda to improve the health system in public health facilities. And it's currently working on projects like antimicrobial resistance, cancer screening, and wound management project. I personally have participated in writing a research paper called Delivery of Respectful Midwifery Care in Uganda. My topic today is I'm going to talk about the use of available resources in a low-income setting country on a wound management project. In 2021, I was in UK for a tissue viability course from the University of Salford under Commonwealth Fellowship, where I attained more skills and knowledge on wound management. When I came back to Uganda, I was appointed to work on a wound management project in Fort Portal Regional Referral Hospital because it had high number of maternal deaths due to sepsis, which means infection. The reasons why sepsis was increasing in the hospital is 1. Misuse of antibiotics, where most patients who come back with sepsis are resistant to most antibiotics that we have in the hospital. Number 2, most patients in the hospital were treated blindly without the use of culture and sensitivity results. Number 3, most staff lack skills and knowledge on how to manage different types of wounds. This is how we manage reducing maternal sepsis in the hospital. 1. We extended the project to other departments that manage wounds like pediatric ward and surgical ward. Number 2, we held trainings and continuous medical education where we invited all staff in the hospital to attend in order to acquire more skills on wound management. Number 3, I formed a sepsis team on the ward that contains all cadres: a gynecologist, a doctor, an intern doctor, a pharmacist, a lab technician, and a nurse to oversee the complicated septic cases on the ward, thus reducing maternal sepsis. Number 4, we held virtual wound management clinics in the hospital where 2 teams attended, that is Uganda and UK. This is how we did it. We got a septic case on the ward, seek consent form, take history, the diagnosis, the treatment the patient is on, the tests done, then after take a photo of the wound. We later present this case via the virtual clinic and then after come up with a final diagnosis. The good thing, all the patients presented in these virtual clinics were discharged home alive. Number 5, I came up with an idea of using drapes, which can be applied on the wound during the wound dressing procedure to provide a sterile environment, and they can be reusable. Number 6, I came up with an idea of using honey gauze. Honey has 3 components: anti-inflammatory, antioxidant, and antibacterial, which quickens the wound healing process. Honey gauze has 2 components, 20% of Vaseline and 80% of honey. The reason why we mixed Vaseline with honey is to reduce pain when honey is applied directly on the wound. As I conclude, these are the points to note while managing wounds. 1. Infection prevention and control. Remember, we have hospital-acquired infection where we have to do hand washing regularly and also hand sanitize. Number 2, teamwork. Wound management is done as a team. Number 3, involving the patient and the caretaker. Remember, these are the people that take care of the incision site while at home. Thank you.